Everyone, my name is Michaela and I'm a registered nurse who works in the intensive care unit of the hospital. Many people wonder how a patient can have a tragic incident that almost has them lose their life, and within a short period of time they're back at home with their family as if nothing happened. It's hard to imagine that could happen, but it does, and today I'd like to inform you on the verticalization bed, which is a specialty bed with the purpose of mobilizing critical patients in the hospital. It's being used in many hospitals, and the results have shown a decrease in adverse outcomes. So the first thing I would like to go over is the verticalization bed. It is a specialized bed that gradually moves a patient from a horizontal position and gradually into an almost vertical position, and the patient is safely strapped in. It gives the brain an illusion that you're standing, but the body is also feeling the physiological benefits of standing. Craig Therapeutics is a company that's creating these. It emphasized how it can be used in early mobilization, as well as that patients up to 750 pounds can use this technology. These beds play a crucial role in their recovery, but it's important to understand why early mobilization is useful in recovering. So, the risks of immobility have been studied time and time again, and almost all the results show that prolonged immobility causes many complications. So early mobilization can help mitigate these risks of things such as ICU delirium, pressure injuries, thromboembolic events, as well as ventilator-assisted pneumonia, and many other things. The NIH actually recognized the importance of early mobilization in a journal called Mobilizing Progress by Emil Singham. He recognized that these risks are mitigated, as well as the decrease in psychological distress that patients faced with the help of early mobilization. So given these benefits of early mobilization, you may be interested in what type of patients may benefit from these beds. So basically anybody in a critical setting can benefit from these beds, but a common situation is someone who's been on a ventilator for many days and they require a sedation drip to recover. These patients are unable to participate in therapy, so verticalization beds can help kickstart that strengthening recovery while they're still trying to get off the ventilator. So the bed turns a full patient into a one assist. So many nurses can get their patients this therapy throughout the hospital, and it's also decreasing the risks of injury in nurses because the bed is virtually doing everything. So how many hospitals are using this bed? There's more and more every day. It could be a few beds rented in the hospital, or the whole unit has them. Out of the top 10 hospitals, over 350,000 beds are in these hospitals, and they're all using it to kickstart early mobilization. So in conclusion, the verticalization bed is a therapeutic tool that is used to prevent adverse outcomes and aid in early mobilization. Patients are able to be mobilized early, they are preventing adverse outcomes, and it is beneficial to all who need assisting, and it is implemented more and more each day in the hospital. As an ICU nurse, I witnessed the beds being used and the ability to help patients become mobile at very early stages of the recovery process.